everyone. Good afternoon. Welcome to a new class. This class we're gonna revise some things related to phrasal verbs. We're gonna revise some stuff related to past modals as well as modal verbs. And so I need you to be very attentive in today's class because it is vital to fulfill the rest of activities that we have on the next days, right? So let's start with this class right now. Okay, guys, look. Okay, guys, we were talking last class about past modal verbs. I wanted you to look at the grammar structure. We have modal plus have plus verb in past participle. You can see here Tamal and Doña Mechis. She is here trying to give you some tamal. That's delicious. And let's see what is the idea of this. Our teacher could have brought tamales for the class, but we have virtual classes. That means that I could have brought here to the class tamales, but we don't have classes live, right? We have virtual classes, which is completely impossible for me to bring some tamales for you guys to eat. So this is a shame, something that was a very good idea in the past, but it's not possible. Okay, the next one. We could have eaten tamales and we could have shared with each other, right? That was a very good idea in the past, but the reality of today is that we have virtual classes, so we cannot eat tamal. You can eat tamal at your house and I can eat tamal at my house. Okay, and the last example is Doña Mechis would have been happy with the sales, right? So we have different uses for these past modal verbs. The first one, let's examine the first one. Our teacher could have brought tamales for the class. This is talking about a possibility in the past. We could have eaten tamales and we could have shared with each other. I am imagining what could have happened in the past, so it talks about also a possibility. And Doña Mechis would have been happy with the sales is a supposition that I make myself about the situation going on. So we talk about different things when we talk about modal verbs, in this case past modal verbs. Let's see other examples here. We could eat tamales every day, but that's not good. That's not good for our health. This is talking about modal verbs. With modal verbs, you have different possibilities. You can recommend, you can suggest, you can ask for something, you can do different things with the modal verbs. You can suppose something, you can respond to a possibility, you can give permission, well, you can suggest something. Well, I mean, the possibilities are infinite with the modal verbs. In this case, for example, we could eat tamales every day, but that's not good for our health. We are supposing something that can happen. It is possible to happen, and we project it to the future. We don't talk about the past here. This is very important. We could eat tamales every day. This is a possibility. If we could eat tamales every day, but we are not eating tamales every day. So look at this example. It says Sylvia should bring hot chocolate and the rest could bring some colombiana and poker. We would prepare some refajo, right? So these are things I think could be possible in the future if we have courses, not virtual, but courses here, live courses, but that's not possible right now. So I am just imagining. When I say should bring, I am suggesting Sylvia to bring hot chocolate. When we say could bring or would prepare, we are trying to think what could happen in that moment. could bring is a possibility. Maybe we could bring this or that. We have different options. We could bring wine, we could bring chips, we could bring hot dogs, whatever, right? And we would prepare. I am projecting myself into the future. Here when I use the modal verbs, normally I'm projecting myself into the future. I'm not talking about the past. I'm talking about the future here. So it is very important for you to understand that normally the modal verbs are used to suggest, to recommend, to talk about possibilities, but the past modals are something completely different. Let's see what is the difference here. I may eat just one tamal because I shouldn't have them. I'm on a diet. I wouldn't resist not eating. I must not eat more than one. Sorry, I had a mistake here. It's not then, but than one. Okay? So you can say I may eat. It's just giving me myself a permission. I may eat. Yo podría comerme. I could eat just one tamal because I shouldn't. It is not permitted for me. I'm not giving myself authorization to do it. Sorry. So I wouldn't resist. Again, I'm projecting myself into the future. I wouldn't resist not eating. I know myself, and probably I want to eat some tamales if I see everybody eating, right? So it says I must not. This is a prohibition. So modal verbs here have different types of functions. We can, as I repeat one more time, we can think about possibilities, we can deny permissions, we can conceive permissions, we can project ourselves into the future, think about the possibilities that we have, right? And we can make prohibitions about something, right? With must. Must is a very special modal verb. You can give a permission or you can just say no. When you use must not, it is a prohibition. You must not cheat on the exam. You must not play video games, right? Stuff that you can't do, right? Okay. Now let's analyze these past modal verbs. Look at this guy. He's eating very, I don't know, he's very hungry. I can see in the picture he might be very hungry. So I suppose I make myself from the image, I think the man must have been hungry, right? Because I think that he is eating very fast. So here this man is an evidence of something that I speculate, right? This is an evidence of a man eating very fast. So I see a man eating very fast and I say, oh man, this man must have been very hungry. I am making hypotheses myself about the situation that I see. Let's say, for example, I see a woman and she's crying, and she's texting and she's crying, she's texting and crying. So I suppose that she must have had a fight with her boyfriend, or excuse me, she must have felt very sorry about some situation, right? I suppose something, I speculate, I try to think what might be the possibility of that situation. I can say here, for example, he could have eaten the entire plate. He was very hungry. So, like, I'm trying to exaggerate the situation because I see that the man was very hungry. So, he could have eaten the whole plate, right? Because he was very hungry. So, I try to make that conclusion out of my mind if I see a situation like that. Okay? Now, how we can solve this here? For example, we have other examples that mean regret, right? Berate, or possibility. So he could have eaten breakfast instead of being hungry the whole morning. The thing is that this guy, that man, was not eating his breakfast. That's the reason why he's eating very desperately in the lunch and he's eating all the pasta. So I can say he could have eaten breakfast instead of being hungry the whole morning, right? Because I am aware of the situation. Now I can make a judgment about his behavior. I can say, man, you could have eaten breakfast, so you don't have to eat everything like that. The next example here, he should have eaten breakfast instead of being hungry the whole morning. I know this guy, his name is Brian or something, and I say, Brian, you should have eaten breakfast instead of being hungry the whole morning, right? It's like I claim him for his attitude. He could have done something earlier, so he can avoid that situation here, right? That is the past modal verb. Like, we think about the possibilities that were permitted in the past, and we didn't make those decisions, right? So let's say, for example, I had to call I don't know, a guy for a job interview, I don't know, and I didn't call him. I had to call him and I didn't call him, and then I hear away apart some other people saying, oh, that job was really good, and I say to myself, man, I could have called the guy so I could have had that job, but it is not possible because it happened in the past. Now it is not possible to do anything. Okay? Now let's link this to another topic I want to talk about, and it is the third conditional. In the third conditional, we have a condition and we have a result, right? We have a condition that is used normally, taking into consideration the causes of something, and then we show the consequences here. So we say, for example, he could have eaten breakfast if he had had good habits, right? So I am making a condition out of his habits, right? His habits are not very good, so I say if he had had good habits, he could have eaten breakfast. Notice that here I am putting the result first and then the condition. I can do it backwards. I can say if he had had good habits, he could have eaten breakfast, right? I can flip over the condition or the result. It doesn't matter. The result is the same thing. I am making a condition and there is a result. Now another one. If Anna hadn't prepared him a plate of pasta, this is the condition, he wouldn't have had anything to eat, right? I think about the logical consequence of some problem. In this case, I say if Anna hadn't prepared him a plate of pasta, right? Because he's eating a plate of pasta and he didn't prepare the plate of pasta. It was Anna. He wouldn't have had anything to eat, right? I'm supposing here that if he hadn't been cooked a plate of pasta, he wouldn't have eaten anything. So, and the next and third sentence, it says if he hadn't been so hungry, he would have eaten carefully. He's eating like very aggressively, so he's like spraying all pasta all over the table. So of course I can say that if he hadn't been so hungry, right, he would have eaten carefully. Now this is the third conditional linked to this past modal thing. So I want you to think about this very much, and I want you, please, if you have some questions, address them to me. Now we're gonna see some stuff about vocabulary. We have, for example, this vocabulary here. You have some sicknesses and some diseases. We are gonna change a little bit about the topic, and we're gonna see vocabulary related to symptoms, sicknesses, illnesses. So we have measles, sorry, and it's all the spots that we have when we have some kind of chicken pox. Backache is when we have a very bad ache in the back, like our back hurts. It's a lot of pain in the back. Fever is when we have temperature, right? To cut is when you like just cut your finger with a knife, or cut your finger with something, your arm, something like this, probably you can see this. I have a cut here. Cold is when you experience like chills and stuff. Bruise is when somebody hits you and you have a bruise. Let's say you have a swollen eye probably, or you have a bruise because you hit something very hard. That's a bruise. Okay. Toothache is when your teeth start feeling pain. You start feeling like oh, my tooth, right? The shivers is like being like shivering all the time. The flu is when you start like having runny nose. You start like achoo all the time. You feel bad pain in your body. You feel low spirits. Cough is when you start doing that's a cough. Earache is when your ear starts hurting. Runny nose is when your nose starts having moquitos, right? Sore throat is when your throat starts having pain. You just go through saliva and it hurts a lot. Headache is when you have a pain in your head. Stomachache is when you have a pain in your stomach. Broken arm is when you just fall down and twist your arm or something. That's a broken arm. So that's some vocabulary about sicknesses. Now I want you to look at three perspectives about the difference between disease, sickness, and illness. So let's check on these three. Illness is a person's subjective experience of their symptoms, right? An illness is something that I myself experience and nobody else. What the patient brings to the doctor, that's an illness. Now, sickness is a social and cultural conception of this condition, right? Such as fear of rejection. This affects how the patient reacts and also covers what is considered a disorder suitable for medical treatment. And disease is an underlying pathology, right? Biologically defined, the practitioner's perspective. The illness seen in terms of the theory of the disorder. So one thing is the illness and one thing is the disease. Disease is more structured. The illness is more, let's say, popular. Okay? Now, this is the perspective. Sickness is something more punctual. Disease is something less punctual, and the illness is something broader, right? We can say illness, anything, And finally, we have this vocabulary about mental illness, right? A mental illness is a mental health condition that has a negative effect on the way an individual thinks, feels, or behaves, right? When you think about many things, when you're very stressed, you're very worried, that's some symptoms of a mental illness, right? We have our illnesses in our body, but also we have illnesses in our head, in our mind, right? So this is about the mental illness thing. You start feeling about this, and you start crying, and you start feeling very sad, feeling depressed, maybe, I don't know, and you start behaving very differently because you start changing of moods, and you start like doing some stuff that you weren't used to, and you don't recognize yourself as a sane person in that moment, right? So this is all the vocabulary about illnesses. And the next thing I want to show you are these tools. This is called Quizlet. Please, if you type in Google, maybe here, for example, you can go to Google here and you write on the browser, you write Quizlet, right? Quizlet, and it shows you the learning tool, and it's got like a lot of flashcards and stuff like that. This is the website. It is Quizlet, so you have to be very aware of this. Now, what I want to show you here about this is that Quizlet helps you to learn vocabulary very easily. It's a very good tool to learn vocabulary. So you can practice in different ways. You can go here and you can say aprender, escribir, ortografía, probar. So we have right now the mode of fichas. Fichas shows you, for example, the concept here. The concept is here. If you click it, then you have the definition. So headache is pain inside your head. You can give zoom a little bit to the image so you remember, and you can go with the next one. Burned. This is burned when you have something hot and you just touch it, you get burned, right? Stiff is when you have a pain in your neck, for example. It says if a part of your body is stiff, it hurts and is difficult to move. So the most characteristic thing is the stiff neck. And has it happened to you that you have your neck and it hurts and you move and you're like, oh, you move a little and it hurts very much? That's to have stiff neck. Okay, so there's a lot of vocabulary here. What I want you to do is that you follow this vocabulary, and I want you to learn this vocabulary. I want you to practice this vocabulary. For example, with aprender, you have different modes in which you can learn the vocabulary. So what is this? What do you think it is? Heart, keep fit, stomach, receptionist. So let's say it is receptionist. It tells you estudia esto, right? This is very important because this is the right answer and it gives you the input in sound. Let's hear.
Keep fit.
One more time. Okay. Can eat a lot. Appetite, take it easy, check up, headache. So I would say it is appetite, right? And it is correct and you can follow. What is this? Keep fit, brain, stomach, heart. Let's say it is heart. Obviously it is not. It is a stomach, but I'm gonna say it is heart. So it tells me
stomach,
stomach,
heart,
heart,
stomach,
stomach,
heart,
heart. As you can see, you can practice your pronunciation because you can listen to the vocabulary and you can start practicing. Now let's go back here. I want to go back here and I want you to look at escribir, for example. This one is really cool. No, this one. Okay, sorry. Escribir, okay. Let's go to escribir and you can listen or you can read the example here. For example, it says to give a medical care to someone for an illness or injury. I say it is treatment. Treatment. Let's see if that is correct or not. Right? I said treatment. Oh well. And the correct thing was treat. Okay, that's fine. So I hear the definition.
To give medical care to someone for an illness or injury.
And this is the correct answer.
Treat.
Treat. So I wrote treatment and the correct was treat. Okay. So let's continue with the next one. A place where a doctor examines patients. This is I don't know, a room, I guess. I don't know. Probably. I'm just writing whatever. And it is what? Surgery? No, this is not correct. Well, okay.
Surgery.
Yeah, well, okay.
A place where a doctor examines patients.
A place where a doctor examines patients. It could be a surgery. Well, okay. Can eat a lot. I don't know. Appetite. Appetite. Well, I think that is the correct one.
Can eat a lot. Appetite.
Okay. So as you can see, it says here correcto, incorrecto, correcto, right? So you have the options and you start writing. First you study the vocabulary and then you do this. The idea is that you don't skip the other steps. You can have ortografía. I like this very much because you have to write what you listen, right? So one more time.
Check up.
Check up. Okay.
Check up. C
okay.
H E C K dash U P.
Perfect.
Check up.
Okay.
Check up.
Again, check up.
Check up. C H E C K dash.
Wow.
Check up.
Check up.
Infection.
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 Okay, so as you can see, I can write, I can listen, I can practice my skills with this vocabulary. It is really cool. I want you to practice this, okay? Thank you. So I want to show you something else. I want you to do this with some phrasal verbs that you have here, okay? I want you to do this with phrasal verbs. No, not this one, exactly, but this one. Illnesses or injuries. Lie down, right? Passed out, passed away, came round, get over, throw up. These are some illnesses or injuries vocabulary about phrasal verbs. So what is throw up? To vomit, right? What is get over? To recover from an illness, failure, a difficult shock, whatever. What is came round? To become conscious again. What is passed away? To die, okay? What is passed out? To faint, okay? And what is lie down? To put your body in a horizontal position. So these are some fichas, or these are some Quizlets that I want you to practice so you can understand and remember some vocabulary here. Also, we have mental health Quizlet. Anxiety disorder, what is that? You are afraid or worried about a lot, right? You're afraid and worried a lot, almost all the time. What is a panic disorder? A panic attack can last for some minutes, blah, 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 blah. Well, the idea is that you can explore this vocabulary and practice it so you can have the concepts very clear. If you want to take notes, that's perfect. If you want to practice your pronunciation, you know you have some here, you have some options that will help you with that. Aprender, escribir, ortografía, probar, and you can play. You can just practice. Take your time to do this. It is very important to practice the vocabulary because it is vital for the last activity that you have to do. Okay guys, I think this is everything for today, and well, if you don't have any questions, I hope this can help you a lot. Okay, thank you very much and see you.